Hey guys, Dr. Jagoda here. Today we're going to get into Graston Technique for some of the quads, the adductors, but mainly if somebody out there is suffering from knee pain, more specifically a medial collateral ligament or an MCL sprain. This is really when somebody gets some sort of valgus force or force from the outside and they really hurt the inside of their ligament on the knee. So we're going to show you how to self-Graston this type of injury, and we're going to show you what it looks like so that when you come into the office you can actually see what it looks like and what to expect. Alright guys, so we're going to start with the Graston technique with our MCL sprain. So first things first, we got to palpate and feel if there's inflammation. If there's going to be inflammation in this area, you're going to want to use an anti-inflammatory technique. So the MCL is right here at the joint line, and somebody will have pinpoint tender, typically like right around this spot. There are some tendons that run over and into this area, so we have to take care of the whole knee complex, not just the MCL, because other muscles are going to tighten up around, specifically the quad, the adductor, some of the retinaculum around the knee, and maybe in the insertion point right here of the pes anseri, and that's really important, but you also have to be careful there because there is a bursa there, so we can't go too hard. So first thing we'll do is we'll put some emollient down onto our leg here and we'll rub it in nicely. And there is some tenderness for me right around here. Not sure if this is from this type of injury, but you can feel it. So a lot of people will overutilize their hamstring, and this is part of that attachment right here. So you have to be careful there. The first tool I'm going to use on these non-affected injury areas. So meaning I'm going to work the quad very gently to start off very light, and I'm going to just use one hand so that this way this one's not in the area, but you'll see I'll work the quad multiple directions, and the adductor is going to be typically a little bit uncomfortable there, and I'm going to bend the knee a little bit so you can kind of see that I'm going to get into the hamstring here. Good, just like that. And then I'm going to switch directions. Good, just like that. And you can feel it. And I'm going to start going down into this area. I'm going to be really a lot more gentle because we do not want to Graston bone on top of bone here, or the bone on top of the metal, and it'll become a little tender right around here. So we can go really light, and then we can go a little bit harder into that calf area, but not so hard right around here where the attachment point is. Good, so we're going to flip the tool around. Again, I'd be kind of doing stuff like this as well, just changing the angles, loosening up this area. Now, once I want to get into the actual joint itself, what I'm going to do here is point out the joint line, which is like right around here, and I'm going to follow that joint line up and down, short, small strokes, just like that, going back and forth over the joint. And the patient will notice that there's going to be a tender point, either right on the bone, right off the bone, or right in the joint space itself. And I'm going to change my angles, going one direction or the other, and I can feel more tenderness on the inside going downward than I can upwards. And then I'm also going to check my angles, right? We can't just work up and down. Even though the ligament goes up and down like this, we want to make sure that we do some cross friction work. And we can't go completely this way because this joint space isn't this large, right? It's actually a lot smaller. It's only like this big. So we can't shove that in there that way. So we'll have to create an angle to come up. So it's like at 45 degrees. And again, I don't feel too much tenderness going this way. So I would assume going downward, which I do, I have more tenderness this way, which gives me an indication that I need to work more this direction, up and down, and then more of this direction. And then I'll of course work some of the knee. I'll bend it and I'll flex it in all different directions. And of course I'll take another tool if I need to go around the knee and the retinaculum. I'll pick away at the knee if I need to, just like that. And it looks like I'm going really hard, but I'm actually not. And then we'll come right into the quadricep a little bit and then go back into there. If there is some tenderness over these areas, you got to be a little careful. But oftentimes patients with an MCL sprain will have some swelling right around here. If they don't have swelling, they will have some pinpoint tenderness right around on the knee. So you really need to make sure that the knee is taken care of, that it's comfortable. You want to treat the joint not only locked out a little bit like this, but you also want to treat it in a flexed position to open up that space a little bit more as well. Just like that. Alright, so of course this is demonstration, so what we would do is we would continue working on. We would work likely the calf as well further down into it. We would work a little bit more on the anterior aspect of the knee, and we would work a lot more into the adductors and the hamstrings as well. So that is treatment of an MCL sprain. Next episode we're going to look into how to tape for an MCL sprain. So make sure you check that episode out, and we'll see you guys for next episode. Take care. Bye.